I'm an otolaryngologist, but I specialize in rhinology, nasal and sinus surgery, and diseases of the nose and nasal cavity, including allergy. We're busy. We see a lot of sick people, people with complaints of the ear, nose, and throat, and I see a lot more people that have sinus and nasal problems. That's a good question. I chose ENT because I thought it was a nice mix of surgery and medical treatment. It wasn't all just in the operating room. On the other hand, it wasn't all just medical treatment. And the technology has really evolved, and so it was one of the most exciting fields that was evolving as I was in medical school. I think the favorite thing about my job is, we get to help people. There are not too many people that get to say that. On an average day, somebody comes in, they're here with a problem, and they're trusting you to try to help them with their problem. That's probably the most rewarding thing. I think when people come in, they're scared. When you're sick, you're scared. You think, am I ever going to get better? And so a lot of times we're able to help people. Philosophy on treating patients. That was the one question I had the hardest time answering. Probably is to be honest. I think there's some things that we're really good at treating, and there are other things that it's harder to have a fix for. And so you've got to tell people what you honestly believe their problem is and try to help them with what the diagnosis is. A lot of times people are just given medicine or pills are thrown at them, and it doesn't necessarily help. And so sometimes that means spending time listening to what the patient's actually saying. So it takes a little more time, and sometimes we tend to run behind when we do that, but I think that's the most important thing. Well, I initially wanted to go into academic medicine. I had a lot of mentors who were in academic medicine, and I really liked them a lot. My father was an ENT doctor in Mobile, and the thought of coming home, especially when we started having children, was an opportunity I just couldn't miss.